Push it so it's up.
On.
Yeah, that's great.
Mr. Chairman and members of the House of Representatives Judiciary Committee, thank you for the opportunity to present this testimony in support of House Bill H5127. I am an OB-GYN practicing in Providence, Rhode Island, and speaking here today on behalf of the American College of OB-GYNs, otherwise known as ACOG. I am currently the Rhode Island Vice Chair for ACOG. Our Rhode Island section represents more than 140 physicians and partners who are committed to providing safe, evidence-based health care for the women of our state. The Reproductive Health Care Act is crucial to keep abortions safe and legal for the women of Rhode Island, regardless of what may happen at the level of the Supreme Court. Adding to Rhode Island law the main principle of Roe v. Wade, protecting an individual's right to terminate a pregnancy prior to viability, is necessary for the health and well-being of all pregnant individuals of our state. This bill will simultaneously repeal the current state laws that are actually unconstitutional under Roe. Many factors influence and necessitate an individual's need for an abortion. This includes, but is not limited to, rape, contraceptive failure, intimate partner violence, fetal anomalies, and/or illness during pregnancy. As obstetricians and gynecologists, we've been involved with devastating cases where the termination of a highly desired pregnancy is the only available medical option to save the life of the mother. Abortion is healthcare. It is no different than any other procedure we perform. The decision to perform an abortion is never taken lightly, but it needs to be accessible and available. When abortions are illegal or difficult to access, women resort to desperate measures to end unwanted pregnancies, including bodily trauma, ingesting of unsafe chemicals, and reliance on unqualified abortion providers. When I have spoken to my more senior colleagues who were practicing before abortion was legal in the United States, they have seemingly never-ending stories of caring for women who became critically ill, and some of them dying from unsafe abortions. We cannot put Rhode Islanders at risk of going back to these circumstances. According to the World Health Organization, up to 13% maternal deaths worldwide are due to unsafe abortions. Comparatively, a first trimester abortion is one of the safest medical procedures we do, with major complications occurring in less than 0.05%, according to the Guttmacher Institute. Our goal, in order to minimize the risk of complications and mortality, is that no Rhode Islander should have to struggle to find the care that they need. To speak about the Reproductive Privacy Act, this currently falls short of being an appropriate alternative for the citizens of our state as it's written. H5125 provides a revised version of the Quick Child Law, which treats a fetus as a person and is currently unenforceable under the Constitution. Leaving this law on our books creates further confusion about the meaning of this bill and is unnecessary if the true goal is to preserve reproductive choice. The Reproductive Privacy Act also preserves Partial Birth Abortion Act. This has been declared unconstitutional since 1999. It is particularly concerning as this restricts the most common medical procedure used in second trimester abortions. When I perform a hysterectomy, a procedure in which a uterus is removed, I determine the type of incision to make based on multiple clinical factors. To allow for a successful operation, it is necessary that I make this decision without restrictions. You trust that I have enough clinical training and expertise to determine how I approach a hysterectomy, which is why there are not laws about hysterectomy technique. Determining the technique used in performing an abortion should be no different. I need to trust that we know what we're doing and we're performing the technique that is best for our patient. If the Supreme Court were to weaken the support of Roe or reverse that decision, many Rhode Islanders would be at risk of not being able to access necessary care if the Reproductive Privacy Act, as currently written, was the law chosen to be moved forward in our state. Therefore, ACOG cannot support this bill at this time. We all deserve to enter our healthcare provider's office confident that the care we receive will be based on solid, scientific research and experience, and not based on a political mandate from this State House. Just like you want your doctor to have access to all of the best scientifically proven treatments for you and your family, I want the same for myself and every single one of my patients. Showing your support for the Reproductive Health Care Act H5127 demonstrates that you understand the crucial need for protection of access to abortion for all pregnant individuals in this state. We all deserve to rest assured that if any one of us were in the position to need this type of medical care, we could access it regardless of what the U.S. Supreme Court may decide. Thank you.